Hello students, today we will talk about the posterior abdominal wall, part 2. Yesterday we have discussed about the posterior abdominal wall, in which we have discussed about the muscles of the posterior abdominal wall, the anterior relation of the posterior abdominal wall, and the lumbar plexus. Now today we will talk about the abdominal aorta, the inferior vena cava, and their lymph node. First, we will talk about the abdominal aorta. So, abdominal aorta is the continuation of the descending thoracic aorta at the aortic orifice. And where this aortic orifice is? Where this aortic orifice is? This aortic orifice is situated. Aortic orifice means what? It is the orifice situated in the diaphragm. So it is situated in the diaphragm only. And this is the opening which is not situated inside the diaphragm. It is not situated inside the diaphragm. Rather, the diaphragm goes above it. It is above, just above the aortic opening. The diaphragm is just below the aortic opening is behind the diaphragm. It is not passing through the diaphragm. So it is at the level of the T12 vertebra in inferior border, where the aortic opening is, through which the descending aorta comes to the abdominal region. Its length is about 10 to 11 centimeter. Its breadth is 2 centimeter, and it is retroperitoneal. It is situated, it is the posterior most structure, and so it is the retroperitoneal. And it is, of course, the on the posterior abdominal wall. That's why we are discussing it over here. So it extends from the L1 to L4. So you can see in this diagram that this is the aortic opening. This is the abdominal aorta. The lower border of T12 onwards, you could see the aorta, abdominal aorta over here. So this is the picture of the abdominal aorta from L1 to L4, or you could, this is the picture of the abdominal aorta. It terminates at the level of the L4 into two common iliac artery. It is terminating at this level into two common iliac arteries, right and left common iliac artery, which further divided into the external iliac artery and the internal iliac artery. Now we'll talk about the branches of the abdominal aorta. Regarding the branches of the abdominal aorta, this abdominal aorta give rise the branches which are either coming on the anterior aspect. So there are three branches which come from the anterior aspect of the abdominal aorta. One is the celiac trunk, another one is the superior mesenteric artery, and third one is the inferior mesenteric artery. So they are the three branches which are coming from the anterior aspect of the inferior vena cava. This is the celiac trunk. Then we have got the superior mesenteric artery. This is the celiac trunk, and this one is the inferior mesenteric artery. So they are the three structure: superior mesenteric artery at the level of T12 and L1. Then we have got the inferior the celiac trunk at the level of T12 L1. Superior mesenteric artery at the level of L1 and the inferior mesenteric artery at the level of L3. So these are the three branches of the celiac trunk which are coming of the abdominal aorta, which are coming from the anterior aspect of the abdominal aorta. Now next we have to see the branches which are coming from the lateral aspect of the abdominal aorta. The branches which are coming from lateral aspect of the abdominal aorta. In that, which you are seeing that this is the inferior phrenic artery. We are seeing the inferior phrenic artery. This is the lateral branch, which is going laterally. Then we could have the suprarenal artery, and then we have got the renal artery and the gonadal artery. So, talking about the lateral aspect, which are going from the lateral aspect, we have got one, that is the inferior phrenic artery. Then next we have got the suprarenal artery. Third one, we have got the renal artery. And the fourth one, we have got the gonadal artery. Gonadal artery. So they are the four branches which are coming from the lateral aspect of the abdominal aorta. Now we are left with the posterior aspect of the abdominal aorta, the branches which are coming from the back side. So if this one is the scene, so all the structure which are coming from the back side, from the back region, the most important is that we have got the abdominal aorta from L1 region to the L4 region. So we have got the four lumbar artery at the level of each lumbar vertebra. So at the level of L1, we have got the first lumbar artery. At the level of L2, we have got the second lumbar artery. L3, we have got the third lumbar artery. And the L4, we have got the fourth lumbar artery. So as the name suggests, is the lumbar one, L1, so the first lumbar artery. L2, the second lumbar artery. L3, the third lumbar artery. And 4, the fourth lumbar artery. And one is the medial sacral artery. This one is the medial sacral artery. This is the one branch which is coming from the back. So total 5 branches which are coming from the dorsal aspect, the 3 branches coming out from the interior or the ventral aspect, and there are 4 branches which are coming from the ventral dorsal aspect. So this is the name of the arteries, and they are paired or unpaired. So we have seen that the celiac trunk is unpaired, the superior mesenteric artery is unpaired, and we have also seen the inferior mesenteric artery is unpaired. Now the paired remaining artery, the middle suprarenal artery, the renal artery, the gonadal artery, the inferior phrenic artery, the lumbar artery, medial sacral artery, and the common iliac artery, they are all paired. They are all paired. Regarding the numbers, where from they are coming, we have seen that T12 level, celiac trunk, L1 level, we have seen the superior mesenteric artery, L3 level, we have seen the inferior mesenteric artery. Now the remaining one, the middle suprarenal artery, L1, renal artery, L1, L2, gonadal artery, L2, inferior phrenic artery, T12, lumbar artery, we have already seen that coming from L1 to L4, and medial sacral artery at L4, and common iliac artery is also coming at the level of the L4 vertebra. Now, regarding the supply, so celiac trunk, it is the artery of the foregut. The superior mesenteric artery is the artery of the foregut, and inferior mesenteric artery is the artery of the foregut. Superior mesenteric artery is the artery of the midgut, and the inferior mesenteric artery is the artery of the hindgut. The middle suprarenal artery is supplies the suprarenal gland. The renal artery, as the name suggests, it will suggest kidney and the suprarenal gland and ureter. The gonadal artery will take care of the testes and the ovaries. The inferior phrenic artery will take care of the diaphragm and the suprarenal gland. The lumbar artery will take care of the abdominal wall. The medial sacral artery will take care of the medial sacral artery, the vestigial artery, and the common iliac artery. Now its external and internal branch will supply the lower limb, pelvic region, and the wall of the pelvis. Now it's relation, regarding the relation of the abdominal aorta, which is a very important one. So anterior relation, we talk about the anterior relation between the celiac trunk. We see this is the celiac artery. We have seen the celiac artery over here. So between the celiac trunk and the superior mesenteric artery. So what are the structure which are coming? So we have got, first we see the celiac ganglion, then we could see the body of the pancreas, then we could see the splenic vein. So these are the structure which are coming in between the celiac artery and the superior mesenteric artery anterior relation to the abdominal aorta. Now we talk about the anterior relation between the superior mesenteric artery and the inferior mesenteric artery. So the first one, the renal vein, then we have got the uncinate process of the pancreas, the third part of the duodenum also. Now what we have seen that it is passing, the superior mesenteric artery is passing through the pancreas, and this could be understand by this picture that the superior mesenteric artery is lying between the body of the pancreas and the uncinate process. So above the superior mesenteric artery, we have got the body of the pancreas, and below the superior mesenteric artery, we have got the uncinate process. So, and below the third part of duodenum, what we have seen, we will see the anterior relation, the inferior mesenteric artery, and the coils of the intestine. And what makes it interesting is that this coil of the intestine, so we have got the fold of peritoneum over here. So only the part of the abdominal aorta, which is below the inferior mesentery, inferior mesenteric artery, is being covered by the peritoneum. So posteriorly, it is related to L1 to L4 vertebral lumbar veins, and right side we have got the inferior vena cava, and the left side we have got the sympathetic trunk. You could see in this diagram also. See this one. This is the right side. We have got the abdominal aorta. Then we have got the inferior vena cava. This is the inferior vena cava. We have got the abdominal aorta over here. Abdominal aorta over here. And we could appreciate the sympathetic trunk over here. Sympathetic trunk over here. So now coming to the aortic aneurysm, which is an important one. Aortic aneurysm is nothing but the dilatation of the artery. It is the dilatation of the artery. And when it becomes more than 1.5 times more than the original diameter, then the abdominal aortic aneurysm appears. And the abdominal is the common site for the aneurysmal changes. This abdominal aorta is the commonest site for the aneurysmal changes. The patient may experience the abdominal pulsations, abdominal pain, back pain, and it may also compress the nerve root, causing the numbness and in the lower limb. So this is all about the abdominal aorta. Now we talk about the inferior vena cava. So inferior vena cava is also a vein. It is the largest vein. It drains blood from below the diaphragm. Below the diaphragm, the blood is being drained by the inferior vena cava, and it also passes, it enters the thoracic cavity. From the thoracic cavity, aorta was coming, descending aorta was coming just behind the diaphragm through the aortic opening and entering into the abdomen. Now the inferior vena cava enters into the thoracic cavity through the opening in the central tendon of the diaphragm. This is we have got the central tendon in the diaphragm, and through which the inferior vena cava is opening, and through which the inferior vena cava opens into the right atrium. It goes into the right atrium. So its length is 23 centimeter, breadth is 2.5, and its formation is opposite L5 by union of the common right and left iliac vein. This right and left iliac vein combine together to form the inferior vena cava. Now its course is larger course than the aorta, ascend in front of the vertebral column. We are seeing the vertebral column is here, and it is in front of the vertebral column. At T8 passes through the diaphragm central tendon. There will be opening for the inferior vena cava. It will enter through it, and it will pierce the fibrous pericardium and open to the right atrium. And the opening is being guarded by the semilunar valve and extend right of L5 to L8. It is right side, and aorta is on the left side. Now relation of the inferior vena cava, which is very important. Now talking about the anterior relation, we could appreciate the root of mesentery over here. See the root of mesentery over here. This is the root of mesentery. And the above it, the third part of the duodenum. You could see that the duodenum over here. You could see the duodenum over here. So anterior relation is the duodenum and the root of the mesentery. In the infracolic and in the supracolic compartment, it will be the portal vein. In the supracolic, you could see the portal vein over here, And then we could see the pancreas over here, the pancreas is over here. And above and behind the peritoneum, behind it will form the posterior wall of the epiploic foramen, Regarding its tributaries, as the name suggests, the vein follow the artery. So common iliac vein with formative tributaries, then the lumbar vein, then inferior phrenic vein from right to left, hepatic vein right, middle, and the left, renal vein right and left, gonadal vein right, and the suprarenal vein right side. So we could see the hepatic vein over here, the right suprarenal, right renal vein, right gonadal vein, common iliac vein. So these are the veins which are draining into the inferior vena cava. Now, finally, we talk about the lymph node. Regarding the lymph node, so lymph node, the posterior abdominal wall is divided in two groups. One is the pre-aortic and the other one is the para-aortic. So the pre-aortic is the origin of the three ventral branches, and the para-aortic, as the name suggests, alongside the aorta, origin of the paired visceral and the somatic branches. So lymphatic drainage from any viscera follow back the artery, it does not follow the vein. So overview of the afferent and the efferent lymphatic channels. Talking about the celiac nodes, they retrieve the lymphatics from the node draining organ supplied by the three branches of celiac trunk, that is the liver, the stomach, the pancreas, and the spleen, and drain into the intestinal trunk, efferent drain into the trunk. Regarding the superior and inferior mesenteric lymph node, and they will drain from the duodenogenital flexure up to the pectinate line of the anal canal, and they will drain into the celiac node. Now the para-aortic node, they were the pre-aortic node, para-aortic node, present in relation to the lateral or dorsal branches of the aorta, receive afferent from the visceral and the other structures supplied by the lateral and dorsal branches, namely the kidney, the suprarenal, the posterior abdominal wall, ureter, gonad, uterine tube, and upper part of the uterus, and also receive afferent from the internal and external iliac lymph node, pelvis, and the lower limb, and efferent drain into the lumbar trunk. Efferent will drain into the lumbar trunk. Finally, the lymph node and the lymph trunks. So lymphatic drainage from the viscera and other structure follow back along the arteries. It will not follow the vein. And the lymphatic from all these nodes will join to form the abdominal lymph node, which are four major lymph trunks are followed. Efferent from the celiac, two intestinal lymph node. Efferent from the para-aortic, two lumbar lymph node. And this trunk will ultimately drain into the cisterna chyli. So this is all about the today's lecture, and with this we finish the posterior abdominal wall. Thank you.